People were on the barricades, they weren't sleeping. And then once the shootings started and the violence started and there were kidnappings and torture, those types of traumas started. People saw people die next to them. There was Molotov cocktails and fires and the fear of the riot police attacking.
People were out on the streets protesting against what was going on, and there were gunmen shooting them. So basically people who had no weapons were shot by professional killers, more than 100 in 3 days.
There's lots of grief and uncertainty, and people are getting lost in all this.
A group of 20 psychologists, psychiatrists, social workers, and priests came to Yale for a week-long training, primarily focused on psychological first aid, skills for psychological recovery, screening for post-traumatic stress disorder, strategies for providing services and mental health services, and also focusing on the interdisciplinary nature of working together. The goal is that the group will return to Ukraine, train others, it's a trainer of trainers, and work with governmental agencies and NGOs to build up the psychological care services, mental health services for the general population, for soldiers, for families, and for children.
We need to build strong public campaigns to spread the knowledge of what we can do. Many people have lots of prejudice and lots of suspicions towards psychologists and psychiatrists, and we are trying to change it now. And we heard from many people from Ukraine that they didn't know that psychological services could be so useful for them.
Ukrainian society has to know how to re-socialize people who've been on the front lines, children who have witnessed trauma, and refugees who've been displaced by the conflict and the war. So in terms of the need, it's an immense need.